Hello and welcome to the introduction to a series of presentations that I've titled The Scientific Holistic Approach. They are based on CPD meetings that I was doing before lockdown. They are not a substitute. This subject needs to be interactive. It needs to have interruptions, hands flying in the air, questions and demonstrations. These are just tasters, and I'm going to talk to a few slides whilst you read them. First of all, I just want to explain something about the order of the presentations, and in the meantime I'm going to shrink myself down so at the moment I'm really nothing more than a distraction. So there are 8 presentations. The ones that are in dark blue, these are related to the subject and the holistic concept in general. The pale blue ones are about sleep, and the ones in green are about hypnosis and the role of hypnosis, and why I believe that all healthcare workers should do the foundation training at the British Society for Clinical and Academic Hypnosis, and I'll tell you more about that towards the end. I feel a need to introduce myself. I'm John Duthie, and normally I've no problem in doing this, as I would do it along in the normal format of things, and I wouldn't. But I do feel as if you need to have an idea of where my internal beliefs come from and why I feel I've got an opinion that's valid. So I'm going to try and explain a little bit about that. So this is my grandfather. He was born in 1868. His mother died in childbirth, and his father, a Presbyterian minister no less, couldn't look after him. He was brought up on a farm in the Highlands, and he was educated till he was locally in the Highlands, but then he was charitably educated by the Edinburgh Merchant Company at George Watson's. That was originally a hospital school, but it became a college in about 1870. And George Watson's was where he showed promise, and he was allowed to go on and study medicine. Now, as the merchant company took on responsibility for former charity pupils till the age of 25, he went on to do medicine, and his education fees were covered by the charity. He studied under Joseph Bell, famous for his forensic diagnostic technique, and Conan Doyle was his personal assistant, and he was the character that Conan Doyle based Sherlock Holmes on. Patients were examined, clothes on, clothes off, open-mouthed and every orifice inspected. Chests and abdomens were listened to and prodded. Urine, faeces and saliva were subjected to visual, kinesthetic, olfactory and even gustatory senses. Pus was smelt and the qualities recorded. As deaths occurred, they were all subject to post-mortems where possible. This was a holistic learning process. And he became a surgeon and a general medical practitioner and went to work in the industrial part of Blackburn, looking after the mill workers and the factory workers. He had 8 children, and the 3 that are circled here, these all became doctors, one of which is my father. And my father was born in 1897, and he had his training interrupted by the Great War. These guys had to cope with smallpox, measles, whooping cough, TB, venereal diseases, polio, industrial accidents, osteomyelitis and gangrene, as well as all the maternity issues. They did operations on the kitchen table and amputations in factories and down mines. They carried a surgical kit, and ether and chloroform masks were in their bags. There were no antibiotics, and attention to details of cross-infection was important. They arranged for isolation hospitals to be built, and the designs were detailed. In Blackburn, there were 4 separate single-storey buildings, all with high-voltage ceilings, floor-to-ceiling windows, and each had a window. There was a window between each bed, and each window had opening casements at the top and the bottom. There were doors at each end of the building. Most importantly, there was a weathercock visible from each ward. There was a prescribed pattern of window opening and closing for all wind directions, and this ensured that the Venturi effect was used to suck air in, up and away from the patient and outwards. Bedding was changed every day, and any time it was contaminated by body fluids. They had many maxims, but the one that stays with me most is never let the sun go down on puss. They would turn in their graves to hear the chief medical and dental officers declaring antibiotics without surgical drainage as a national policy. All consultation involved looking in the mouth, feeling all lymph nodes, and it was rare for a patient to escape without taking their clothes off. Then there were the family discussions about the Beveridge report and the inception of the National Health Service, which they supported. Ask why the 5 barriers of health in 1942 became the same drivers of ill health in 2020. My family and many other doctors and scientists of the time were in favour of the Herbert Morrison vision. That was the vision for the National Health Service, and not what they described as the Russian model. They feared that state centralization would lead to the politicization of science and healthcare, and we would breed a lot of Trofim Lysenkos. They may have been right. Ask again why the 5 barriers of health in 1942 remain the same drivers of health in 2020. The science of economics has played its role in the failure to implement recommendations of the Beveridge report, and a holistic approach to this subject also needs to be taken if we are to solve the planetary and human problems faced today. This is an image of the holistic model of how economics needs to work, and you'll see there that this is the concept of Kate Raworth donut economics. So, a holistic approach to this subject needs to be taken. And why such poor decision making from international government level down to the individual? These are just a few of the thinking errors that I spotted whilst listening to the triumvirate announcements of the oligarchy that I looked at during lockdown. So here are my internal beliefs. I believe that most people are well-intentioned, and that includes me. But we are all subject to the corrosive influence of bias, systematic distortions of thought, the power of rationalization. I can rationalize just about any decision I want to take. It's a powerful effect. There's also, I believe, that the guises of self-interest have to be guarded against. And then there is the inevitability of unintended consequences. And for those, we have to be prepared to change our minds and update our scientific views almost on a daily basis. So why do I believe that my career experience gives me an opinion that's valid? Well, here's a potted CV. The first postgraduate course I did after qualifying in dentistry in 1974. In 1975, it was the foundation training for the British Society for Medical and Dental Hypnosis, and that has become the British Society for Clinical and Academic Hypnosis. And this prepared me extremely well for my first encounter with the White Witch of Wavertree, but that is a story for another time. She taught me a lot, and at the meetings I will be telling you more about her. I went back to do academic training, to do fellowship training, and became a member of the Royal College of Surgeons, and as well as my practice, I worked at Liverpool Dental Hospital treating medically compromised patients, and at the time these were the nervous patients requiring general anaesthetic, sedation and hypnosis, and this worked extremely well. By using hypnosis, I managed to reduce the need so that those people who thought they needed general anaesthetic and they needed IV sedation, the ones that thought they needed IV sedation we did with formal hypnosis, and the others we just did with a sympathetic approach utilising waking or informal hypnosis. So that was happening at the time, but that got cut short because the department got moved thanks to the emergence of HIV infection. So I was moved to then start treating the medically compromised. This was a big learning curve for me. I had to go back and redo my microbiology, virology and mycology. I had to look seriously at all our protocols about the cross-infection control, and I had to prioritise and do risk assessments, and there is nothing like being up to your wrists in the blood of an HIV haemophiliac to concentrate the mind. We made a considerable number of mistakes, and that is one of the reasons why I think we have to take a step back, particularly with the COVID and with the attitudes that are abounding today. I took part in dental politics. I was on these committees along with the original family practitioner committees, which were quite big and unwieldy, but they were certainly democratic. And I was a member of the founding committee for HIV infected healthcare workers. On the materials science side, I was a Northern European consultant for a German company called SBA, which is now 3M SBA, and I was, up until the Brexit occurred, working for the German company for 28 years, but I had to give up because I could no longer guarantee that I could complete the research. On the academic side again, I became an examiner for the FGDP, and on an international basis went to Hong Kong and visited China to look at how dentistry was provided there. Later on, thanks to the experience with the material science, I became an international trainer with the International Society for Computerized Dentistry, dealing with the manufacture of ceramic restorations. So, why a paradigm shift in philosophy now? Well, there have been no new drugs for mental health for 20 years. The neuroscientists think there may have been a mistake in the original premise. Cartesian dualism has misled us for some considerable time. And now we know that inflammatory cytokines pass the blood-brain barrier. And Professor Ed Bullmore has written a very simple, well-written book called Inflamed Mind. Inflammation in the immune system and brain function are intimately connected, and so we need to take notice of this. There have been no new antibiotics for the last 20 years, and microbiologists are now beginning to emphasize the importance of the microbiome, the estrobolome, and the incidence of heart disease, stroke, diabetes, obesity. They remain high despite our best efforts. On the dental side, my career started in dentistry. We knew that prevention worked, but nothing much else did, and I set up a squat practice based on that philosophy. And in 1979, the James Report was never published. If you wanted to read it, you had to get it requested to a central library. You could go in a room, you were locked in the room, you could read it, you couldn't copy it, and you couldn't take it away. So I went down and read it. 1985, NHS tries prevention. But they didn't do primary prevention, they did secondary prevention, which fails. And in 1990, they introduced a new NHS dental contract, which was supposed to deliver prevention. It was beginning to work, but they abandoned it in 1992 in July. And then, of course, we have the new NHS contract in 2006, which, in my opinion, is disastrous, but maybe somebody wants to contest that. And in 2019, Tom Watson, the deputy leader of the Labour Party, stands up in Parliament and says exactly what the 1979 James Report said. So that's 40 years of knowledge not implemented. Why? Why not? Why such poor decision making and errors at a high level by intellectual people? And you know, if this problem was just limited to dentistry, it wouldn't worry me so much. The problem is it's not. And in the next presentation, I'm going to go on to try to explain why. So, we are mind-body organisms, and a knowledge of how we can best use this asset is essential to providing good healthcare and human resource management. And foundation training in medical and dental hypnosis is a good place to start if we're going to take a holistic philosophy to life and to our planet. And so, to summarise, I believe that I'm in my 70th year, that I've had sufficient clinical and academic experience to have an opinion that's valid. I believe I've got reflections that are worth sharing, and I believe that the holistic approach is pertinent to all elements of human life. I hope that many of you will come to the foundation training. There's a centre in Warrington, but there are other centres around the country. So, thank you very much for listening. I suggest that the presentations are viewed in the order that I've done them, but if you feel you want to jump around, please feel free to do so. Just don't be surprised if I suddenly refer to something that we discussed in another meeting. So thanks for listening.